Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
Welcome to St. Louis on the Air on St. Louis Public Radio. I'm Elaine Cha. A report last fall from the American Hospital Association showed that more and more hospitals in rural areas are closing. There have been more than 100 that have closed in the last decade. The reasons are varied and include staff shortages, a low number of patients, regulatory challenges, and financial challenges. Of the 161 hospitals in Missouri, 67 are in a rural area, and one of them is Phelps Health in Rolla. Hospital leaders there earlier this week announced that they are joining a collaborative run by St. Louis-based BJC HealthCare. Joining us now to talk about this is Jonathan Ahl, STLPR's Rolla correspondent and our newscast editor. Hi, Jonathan.
Hi, Elaine.
Thanks for being here today.
Oh, it's my pleasure.
Now, before we get into the specifics of the collaborative, remind us how important Phelps Health is to Phelps County and the surrounding area.
Sure. I want to actually start with maybe a little bit of a bigger caveat, is that when we talk about rural hospitals, that includes a huge number of hospitals. And I also want to be very clear, Phelps Health is in great financial position.
Okay.
Full. But those rural hospitals that have closed, those are like the 12 to 20 bed hospitals that are in very, very small towns. So Phelps Health is like one of those regional rural. They've got more than 200 beds. They have a cancer center. You know, it is one of those hospitals that serves a rural area, but they kind of pull in from many, many counties, and it is the biggest hospital for a lot of people within a lot of distance. So how important is that? Well, once you get past Phelps Health in Rolla, the next hospital of that size is either in Springfield, Jefferson City, or St. Louis.
Okay.
So we're talking about, it could be 100 miles away in any direction to get that same level of service. So it's really important. I mean, those little hospitals are really important in those very small towns, but then those regional rurals like Phelps Health are also really important.
Mm-hmm. And to be fair, you've reported before how rural means different things to different people.
Oh, yeah.
And even means different things to different government agencies.
Definitely. I mean, when you talk about even something as simple as a grant program for whether a hospital gets a certain grant, you can talk about how far are they away from a metropolitan area, how many beds they have, what is the population density. There are so many different ways to measure that. So we say rural, but that means so many different things to so many different people, for sure.
Right. And I appreciate the note that you've made about 12 to 20 beds qualifying. I mean, that sounds small, but if there's not much else around, I mean, that also could be huge.
Yeah. So, some of the big things to think about, some of the ways to think about rural healthcare. If you break your leg, where do you go? If you're having a baby, where do you go? And if you need an appendix removed, where do you go? And small hospitals can handle any of those things, especially if they're relatively routine. Mm-hmm. But what if you were 100 miles away from a hospital and you have a broken leg, or you're in labor, or your appendix might burst? So, we look at these very small hospitals, and they're super important. And they need to be there, and they're definitely hurting for sure.
Mm-hmm. Now, you spoke with the CEO of Phelps Health yesterday. What did he have to say about why the hospital is doing this?
So the collaborative is run by BJC HealthCare, which is based in St. Louis, and there are 8 different hospitals and or health systems that are involved in it. And they range in size from like St. Luke's in Kansas City to Rolla. Phelps Health is the newest member, and Blessing Hospital in Quincy is also been part of this collaborative. And Blessing's a pretty comparable sized hospital to Rolla. Mm-hmm. And what they're promoting this as is something that's really good, because it gives these hospitals access to more resources, but they're voluntary, and they don't have to merge. So local control is still there, local decision-making is still there, but a hospital the size of Rolla can collaborate with an oncologist at Barnes, or they can learn from St. Luke's about best practices on cybersecurity, or they can talk to Blessing, which is another hospital of similar size, and say, how do you guys do telehealth? So it's resources for all of them that lets them have that more information to improve patient care, but they're not merging. It doesn't become a wing of another big hospital system. They still get to serve their community and be local.
So they're maintaining some
Yes.
autonomy.
Yeah.
Okay. And partnerships like this, they get announced, but that doesn't speak to how long they've been in the works. Was Phelps Health joining this collaborative? Was it a long time coming?
Well, there have been a couple of changes in leadership at Phelps Health. My understanding, and the current CEO, he's been there for 7 years in a different position. So he said the talks have been on and off for a long time. But that's why I talked to Maureen Kahn, who was the CEO at Blessing, because that was a hospital in Quincy that's about the same size. They've been in it for 9 years. And they said, this is the real deal. This has helped us. This has helped us improve patient care. It's helped us save money, and it helped us not merge. So Blessing has been able to stay an independent hospital, and they credit this collaborative as part of that.
And what is the downside of merging?
The downside of merging, well, is that you end up giving up all your control. Is that like if a small hospital just becomes a satellite of a big hospital, then maybe the specialists come in 1 day a week, or the decisions on pay and on care, they're done in a city that's very far away, not local. So, and there's also just that community feel of it. A hospital is something that's part of the community. People go there when they're in a very vulnerable position, and you want that to be a place that's known and trusted and to be part of the community. So a place like Blessing or Phelps have long, rich traditions of being part of their community, the people living there and working there, and that's very important.
Now, as far as the advantages financially, is it merely something as simple as being able to buy in bulk? What other advantages come with being able to be part of a member group?
Well, let's talk about buying in bulk really quick, because don't think about like buying gloves. Think about buying MRI machines, because those can be like $1 million. And if you can put in an order for 4, you're going to get a much better deal than if you put in an order for 1. So that's where the cost savings is. The other stuff just has to be with sharing information, sharing best practices. That's really what's at the heart of this.
And what is your sense of how maybe the pandemic and everything that has happened around that, how that might have affected this partnership actually coming through?
I think all of us have seen that public health and healthcare systems were stretched to the limit. They were put under stress. They were attacked by people for political reasons when they were just trying to provide healthcare. I think any kind of collaborative where there can be a shared experience, understanding, help each other get through it is super important. And I think the pandemic showed why that's important, and hopefully that's one of the things that these hospitals are getting out of the collaborative.
And lastly, what's been the reaction from people in Rolla?
Well, there hasn't been a ton yet because it's a relatively new announcement. I will say that there's definitely a certain population that is skeptical of anything big city. So that when they hear they're getting connected with Barnes, they may be skeptical of it. But I think if they dig in and realize that there are no requirements and just opportunities, they'll be okay with it.
Jonathan Ahl is STLPR's Rolla correspondent and our newscast editor. You can also read his story at our website at stlpr.org. Jonathan, thank you.
My pleasure.
Today's episode was produced by Alex Hoyer, with audio engineering and podcast design by Aaron Dorr. Our production intern is Avery Rogers. Our executive producer is Alex.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
podcast proudly supports St. Louis artists by using music from Life Creative Group.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.